So the control of secretion. Uh, secretion of saliva is under the control of autonomic nervous system. Okay, there is a baseline level of secretion about zero point 0.5 ml per minute due to ongoing low level parasympathetic stimulation, which prevent the mouth and pharynx from drying out. Okay, on the top of baseline, increases in salivary secretion can occur in response to food activating gustatory receptor or mastication activating mucosal mechanoreceptor or in response to sight, smell and anticipation of food. Okay, however salivation is initiated, the impulse to salivary gland travel via the autonomic nerves. Okay, the sympathetic control of salivary production is via the superior cervical ganglion. Okay, the sympathetic control is by the superior cervical ganglion. Okay, sympathetic innervation cause increased protein secretion, resulting in increased production of the thick mucoid saliva. Okay, the sympathetic innervation causes the increased protein secretion, resulting in increased production of the thick mucoid saliva. Now, there is variable sympathetic innervation between the salivary gland and the generally this system is far less important than the parasympathetic innervation. Okay, in terms of the regulating production of the saliva, so the sympathetic stimulation is the more important than the parasympathetic innervation. Okay, the parasympathetic outflow is coordinated via the centers in the medulla. Okay, innervation occurs via the facial and the glossopharyngeal nerve. This results in the following effect: increased production of saliva by acinar cells, increased secretion of bicarbonate by ductal cell, and increased blood flow to the salivary gland and contraction of the myoepithelium to increase the rate of expulsion of the saliva. Overall, increased parasympathetic stimulation results in the increased flow of saliva that is more watery in composition. Saliva production is decreased by inhibition of the parasympathetic nervous system by sleep, dehydration, then anticholinergic drug and fear. Okay, by sleep, dehydration, uh, anticholinergic drugs and the fear, the parasympathetic stimulus is inhibited. Okay, then function of the saliva. So the functions of saliva in health include general cleansing and protection of the buccal cavity by washing away food particles. General cleansing and protection of buccal cavity. Okay, function. So it cleansing and protection of the buccal cavity by washing away the food particles. Okay, then moisturizing the buccal cavity for speech, then lubrication of ingested food for bolus formation. Okay, lubrication of ingested food. Okay, moisturizing, then the lubrication for bolus formation and the swallowing, then the dissolving the chemicals in food, allowing them to interact more efficiently with taste buds. Okay, dissolving of chemicals in the food, allowing them to interact more efficiently with the taste buds. Okay, dilution and neurotrali neutralization. Okay, sorry, dilution and the neutralization of the acid in food and produced by bacteria, then secretion of digestive enzymes, particularly amylase for early starch digestion, then secretion of the antibacterial enzymes lysozymes, and the secretion of the IgA to protect against the invasion of the microorganism. Okay, these are the function of the saliva. Then secretin. So secretin is secreted by the S cells in the duodenum. Okay, stimulating factors, inhibiting factors, and function. Okay, this all we have seen. Just we will see the secret about the secretin stimulating factors, low pH in the duodenum, and the presence of the products of fat digestion in the duodenum. Okay, inhibitory factors are the secretin release is inhibited by the somatostatin. Function, decrease gastric acid secretion by gastric parietal cells, then inhibit gastric emptying, stimulate the release of pepsinogen by gastric chief cells, then stimulate the pancreatic bicarb secretion, potentiate cholecystokinin induced stimulation of the pancreatic enzyme secretion, and the stimulate bicarb and the H2O secretion by liver and increased bile production. Now we'll see the somatostatin. So the somatostatin is secreted from the D cells in the pyloric antrum, the duodenum, and the pancreatic islet. Okay, in the pancreatic islet, the duodenum, and the pyloric antrum from the D cells. Okay, somatostatin is secreted by the cell throughout the GI tract in response to the H plus in the lumen. Somatostatin secretion is inhibited by the vagal stimulation. Somatostatin act to inhibit gastric acid secretion both directly at the parietal cells via G protein coupled receptor and indirectly via the inhibition of the gastrin and histamine secretion. Somatostatin also act to inhibit secretion of all GI hormones including insulin, glucagon, cholecystokinin, secretin, gastrin inhibitory peptide. Okay, somatostatin thus mediates decreased gastric and the intestinal motility, decreased gastric and the intestinal secretion, decreased pancreatic exocrine function, decreased pancreatic exocrine endocrine function, and decreased bile production and release. Structure of the gut wall. So the gastrointestinal system is essentially a muscular tube. Okay, structure of the gut wall. So the gastrointestinal system is essentially a muscular tube which maintain the same basic structure throughout its length, although this is modified as functional varies layers. So the layer that comprise this basic structure from innermost to outermost are the innermost is the mucosa, then the submucosa muscularis externa, and the outermost is the serosa. Okay, so the first we'll see the mucosa. It composed of the epithelial layer, lamina propria, and the muscularis mucosa. So the epithelial layer, which has the either secretory or absorbatory function, then the lamina propria, consisting of loose connective tissue, blood vessels, and the lymph tissue, and the muscularis mucosa, a thin layer of the smooth muscle. Okay, then the submucosa. Okay, so this is the mucosa. Okay, then the submucosa, then the muscularis externa, and the serosa. Okay, so here the then the submucosa contains second layer of connective tissue, larger second layer of the connective tissue. Okay, then larger blood vessels and the lymphatic vessels and the submucosal plexus. Okay, muscularis externa composed of the inner circular muscle layer, then the outer longitudinal muscle layer, and the mesenteric plexus. Okay, muscularis externa have the inner circular layer, which when it contract produces the construction of the lumen. Okay, outer longitudinal muscle layer, which when contract results in the shortening of the GI tract, and the mesenteric plexus, which lies between those two layers of the muscle. Okay, there is a mesenteric plexus. Okay, these three are in the muscularis externa, and the outermost serosa, another connective tissue layer. Okay, uh, covered with squamous mesothelial cell. Okay, covered with the squamous mesothelial cells. Okay, so these are the layer of the gut. Okay, layer that contains basic structure from the innermost to outside. The mucosa will contain the epithelial lamina propria and the muscularis mucosa. Muscularis mucosa have the smooth muscle, and the epithelial layer have the secretory or absorptive function, and the lamina propria will have the connective tissue, blood vessels, and the lymph. Then the submucosa will have also the connective tissue. Okay, and the outer the third is the serosa will also have the connective tissue. Okay, the muscularis externa will have the inner circular, then the outer longitudinal and the mind direct plexus which lies in between this. Okay, innervation. There are two intrinsic nerve plexus which function, two intrinsic nerve plexus which function as the uh, enteric nerve system. Okay, which function as the enteric nerve system. The activity of which is moderated by the extrinsic innervation and the hormones. Okay, these are two intrinsic nerve plexus which functions as the enteric nerve system, which function as the enteric nerve system. Okay, intrinsic nerve plexus, and it function as the enteric nerve system, the activity of which is moderated by extrinsic innervation and the hormones. Okay, it's innervated by the extrinsic innervation and the hormones. The submucosal plexus, Meissner's plexus, is located in the submucosal layer. Meissner plexus is there is a Meissner plexus and the enteric plexus. There is the Urbach plexus. Okay, submucosal plexus have the Meissner plexus. Okay, so this locate Meissner plexus or submucosal plexus is located in the submucosal layer. Okay, the submucosal plexus only has submucosal layer. Okay, the second layer. Submucosal plexus only has parasympathetic input and provide secretomotor innervation to the mucosa, mainly regulating epithelial cell and submucosal blood vessel function. Then the myenteric plexus or Urbach's plexus is located between the circular and the longitudinal muscle layer. Okay, there is the myenteric plexus. Okay, called the Urbach's plexus layer of the muscularis externa. The myenteric plexus provide motor innervation to the smooth muscle. Okay, provide motor innervation to the smooth muscle. Okay, motor innervation to the smooth muscle. Okay, smooth muscle layer via sympathetic and the parasympathetic input. Okay, innervation by the smooth muscle layer via the sympathetic and the parasympathetic input, mainly regulating the intestinal motility and the sphincter function. Okay, regulating the intestinal motility and the sphincter function. So as we have seen, there is the mucosa will contain the epithelial lamina propria and the muscularis mucosa. Epithelial lamina propria and the muscularis mucosa. The Meissner's plexus located in the submucosal layer. Okay, so this is the mucosa, then the submucosa. The Meissner plexus located in this layer. Okay, there is the gland in mucosa and the duct of gland outside the tract. Okay, then the okay there is the submucosal or Meissner plexus. Okay, they are here. Then the muscularis. Uh, okay, that this is the Meissner plexus. Then the muscularis. They are the circulating and the longitudinal muscle. Okay, circulating and the longitudinal, and in between that there is the mindyric plexus. Okay, then there is the serosa. They have the areolar connective tissue and the epithelium. Okay, serosa have the areolar connective tissue and the epithelium. Okay, then we will see the swallowing. So, swallowing is the controlled transport of food bolus from the mouth to the stomach. Okay, involving a sequential reflex. Okay, transport of the food bolus from the mouth to the stomach involving sequential reflex, which is coordinated by the swallowing center in the medulla pons, and the consist of three phases: buccal, pharyngeal, and the esophageal phase. Okay, their center is in the medulla and the pons, and it's divided into three phases: the buccal, pharyngeal, and the esophageal. Fibers in the vagus and the glossopharyngeal nerves carry information between the gastrointestinal tract and the brainstem. Okay, fibers in the vagus and the glossopharyngeal nerve. Fibers in the vagus and the glossopharyngeal nerve carry information between the gastrointestinal tract and the brainstem. Okay, fibers in the vagus and the and the glossopharyngeal nerve carry information between the gastrointestinal tract and the brainstem. Okay, information between the GIT and the brainstem. Okay, buccal phase. So what we have seen that divided into three phase: buccal phase, pharyngeal phase, and the esophageal phase, and the fibers in the vagus and the glossopharyngeal nerve carry information between the GIT and the brainstem. Buccal phase, there is a voluntary. During the buccal phase, food is chewed and mixed with the saliva to form the food bolus. Tongue movement then push this food bolus upward and backward against the hard palate, forcing it into the pharynx. Then the pharyngeal phase, it is involuntary. The pharyngeal phase lasts about 1 second and is initiated by the food bolus stimulating mechanoreceptor in the pharynx and firing the impulse via the glossopharyngeal nerve, okay, ninth nerve, and the vagus nerve to the swallowing center. The pharyngeal phase, soft palate elevated, closing of the nasopharynx. Okay, the base of the tongue retract, pushing the bolus against the pharyngeal wall. Laryngeal muscle contract to close the glottis and elevate the larynx, closing the airway. Then breathing is inhibited. The tip of the epiglottis moves over the tracheal opening, closing of the air. The pharyngeal constriction, constrictor muscles contract sequentially from top to bottom, squeezing the bolus downward. The upper esophageal sphincter relax to permit the food bolus to enter into the esophagus. Okay, so this is the pharyngeal phase. As the bolus enter the esophagus, the this changes reverse. The larynx open and breathing continue. Okay, then there is the esophageal phase. In the esophageal phase involves the transport of bolus along the esophagus to stomach by peristalsis. Okay, coordinated wave of relaxation in front of the food. Okay, food bolus and the contraction behind the bolus of the circular and longitudinal muscle of the esophagus propel the food bolus along. Okay, gravity accelerates this movement. The lower esophageal sphincter relaxes as the food bolus approaches the lower end of the esophagus, opening and allowing the bolus to pass into the stomach. The sphincter and the peristaltic waves are principally controlled by the activity in the vagus nerve and aiding by a high degree of coordination of the activity within the enteric nerve plexus within the tract itself. Okay. Then there is the vitamin B12 handling. Okay, on ingestion, uh, sorry, on ingestion, vitamin B12 is bound to. Okay, on ingestion, vitamin B12 is bound to R protein found in the saliva and gastric secretion. Okay, on ingestion, B12 is bound to the R protein found in the saliva and the gastric secretion, which protect it from the digestion in the stomach. Once the vitamin B12 has been separated from the R protein in the duodenum by the action of the pancreatic protease, vitamin B12 bound to the intrinsic factor. Okay, secreted by the gastric parietal cells. Receptors for the intrinsic factor B12 complex are present in the membrane of the epithelial cells in the terminal ileum, which binds the complex and allow uptake of the vitamin B12 across the apical membrane by the endocytosis. B12 is then transported across the basal membrane into the portal blood basal membrane into the portal blood, where it is bound to the transcobalamin 2 and the processed by the liver. Okay, so this vitamin B12 is then transported across the basal membrane. Okay, into the portal blood, when it is bound to the transcobalamin 2 and processed by the liver. In the pernicious anemia, there are auto antibodies against these gastric parietal cells and the intrinsic factor, resulting in the vitamin B12 deficiency anemia. Okay, and last is the vitamins. Okay, vitamin are classified as fat soluble or water soluble. Okay, vitamin A, D, E, K are the fat soluble, and the other vitamin B and C are the water soluble. A, D, E, K are the fat soluble, and the other B and C vitamin are the water soluble. Absorption of the fat soluble vitamin is dependent upon the absorption of dietary fat, and they are stored in fatty tissue in the body, mainly in the liver. Sources of fat-soluble vitamins include meat, fish, and vegetable oils. The water-soluble vitamins are mainly absorbed by the diffusion or mediated transport other than vitamin B12. Diffusion and mediated transport. Okay. Body stores of water-soluble vitamins other than the vitamin B12 are smaller than the store of fat-soluble vitamins. Stores of the water-soluble vitamins include the milk, meat, fruit, and the vegetables. Okay, milk, meat, fruits, and the vegetables are the water soluble vitamin source. Okay, clinical implications. So, effect of the vitamin deficiency include vitamin C deficiency, scurvy, vitamin B1 deficiency, beriberi or Wernicke-Korsakoff syndrome, then B12, megaloblastic anemia, and subacute combined degeneration of the spinal cord, then the B9, folate, megaloblastic anemia, then vitamin D, osteomalacia and rickets, K, defective clotting, and vitamin A, vitamin K, defective clotting, and the vitamin A is the blindness.